Are deep squats safe? Has anyone ever told you that you should never squat below parallel? And then if you squat too deep, it's considered a dangerous movement and you'll increase risk of wearing your knees and cartilage out? And you can even forget about squatting ass to grass under load, because if you do, your knees will definitely explode and your kneecaps are actually going to shoot across the room and blow up into a million different pieces. Today, we're going to be taking a look at whether or not deep squats are actually safe or dangerous, and what the current evidence and literature actually says about this topic. So without further ado, let's roll the intro. What's up guys, Dr. Peter Yu here, physiotherapist and strength coach. Today, I want to talk to you guys about whether or not deep squats are safe or dangerous. Yes, I know what many of you are already thinking. It's 2020, Peter, why are we still harping and talking about this topic? Well, you'd be surprised at the amount of healthcare and medical professionals, and even coaches and trainers that are still demonizing squatting below parallel, claiming that it's a dangerous movement that's pretty bad for the knees and the back. Some of the most common myths and arguments against squatting ass to grass or deep squats is that it can cause increased injury risk to the knees, it can cause compression forces at the knees, can cause increased degenerative wear and tear changes at the knees, and finally that it can cause increased damage to the knee ligaments, specifically that of the ACL and the PCL. Alright y'all, let's take a look at the first argument. Are deep squats bad for the knees, and do they increase risk of injury? A phenomenal review article by Hartmann in 2013 took a look at over 164 research articles. That's right, 164 research articles to determine whether or not half squats or quarter squats would actually be safer on the musculoskeletal system than compared to deep full squats. They took a look at the effects on the knee joint and also at the hip and the back as they changed different squat depths and loads. In the end, we see them conclude that deep squats in fact do not cause increased injury risk to passive tissues in the body, and that it can actually act as a great exercise for protection against injuries, and can also be a great strengthening tool for the lower body. Well, that should settle it. But since we're already here, let's just go ahead and address some of the other issues. A second common argument that you'll hear is that deep squats can cause increased compression forces at the knees. From the Hartmann article, they actually found that retropatellar compression forces are actually highest at the knees around parallel or around 90 degrees knee flexion, and that compression forces actually decrease as you drop below 90 degrees due to a wrapping effect that occurs at the knees. The wrapping effect is basically a theory where when you have a larger surface area, you actually have increased force dissipation and less overall stress. And we'll actually see this as we descend below parallel into a deep squat, because we'll have our hamstrings and posterior thigh muscles actually come in contact with our calf, as well as some of the other ligaments and tendons in our knee, all of which help increase overall surface area and help with force distribution and force transfers in a safe and efficient manner. So in terms of patellofemoral compression forces occurring at the knees, deeper squats are actually going to be a lot safer to perform than half or quarter squats. In the research article, Hartmann and his colleagues actually even went so far as to say the execution of the half squat cannot be recommended because the turning point is initiated in a knee joint angle amplitude, where the highest patellofemoral compressive forces and greatest compressive stresses occur with only a minor tendofemoral support surface. Alright, common argument number 3. Deep squats can cause degenerative wear and tear changes to the knees. Alright, let's bring it all the way back to 5th grade science class where you all learned about Wolff's Law. Wolff's Law basically states that our bones will adapt based on the stresses and demands, or lack of stresses and demands, that are placed upon them. So use it or lose it, right? Our knees are going to have positive anabolic adaptations that are going to be protective against degenerative changes in the future if we continually to load them up in a graded manner through their full available range of motion. However, at the same time, if you never load them, they're never going to adapt, and may even get weaker in the future, which can possibly predispose it to increased risk of injuries. In one of the studies they looked at in the Hartmann articles, they actually looked at cross-sectional areas of the knee joint in professional weightlifters, had higher cartilage thickness, which is actually an increased mechanical stress tolerance advantage compared to those who weren't strength trained. Yes, those are the guys that usually squat ass to grass daily, due to the demands of the sport. So let's load up our knees through their full available range of motion, get them stronger, get them to adapt, make them more robust, make them more resilient, and increase their overall capacity. Fourth and final argument, deep squats are going to cause excess stress and strain to our knee ligaments, specifically the ACL and the PCL. If we take a look at the bottom of a squat position, we see that the ligaments in our knees are actually placed under very little stress. From the research, we know that the majority of ACL injuries actually all occur around that 15 to 30 degrees of knee flexion, and that as you increase depth, you actually decrease forces on the ACL significantly. We also see that the maximum forces occurring at the PCL typically occur around parallel or around 90 degrees of knee flexion. In the review article, Hartmann and his colleagues even concluded that based on their calculations, both posterior nor anterior shear forces could possibly reach magnitudes high enough to harm an intact ACL or PCL in a deep squat. There you have it. Top myths against deep ass to grass squats debunked. Get out there, share the good word, shatter from the streets, hashtag free the knees, baby. With that being said, everyone's full range of motion is different, and so everyone's full depth squat is not going to look the same. There could also be some possible limiting factors preventing people from squatting through their full range of motions, which can include current injuries, pain, or mobility restrictions and limitations. However, if you are a healthy individual, deep full squats are going to be a completely safe movement that you can perform. Anyways, I hope you guys found that helpful. Leave your thoughts in the comment section below. Let me know if you've already been doing ass to grass squats or if you're going to start doing them after watching this video. If you like this video, make sure to give it a thumbs up and be sure to hit that subscribe button. I'll see you guys in the next video, but until then, remember to keep your squats low and your standards high.